For more, let's bring in Dr. William Schaffner. He is a professor of infectious diseases at Vanderbilt University Medical Center. Doctor, thank you so much for joining us. I think what everyone wants to know is how quickly this Omicron wave is going to crest. What do we know at this point based on the data from other countries?
Well, Nancy, we would all like to know the answer to that question, but for sure, the data from other countries is rather optimistic because in South Africa, for example, Omicron shot up exponentially. Oh, wonderful. But then came down actually almost as fast. So it looks as though Omicron at least can spread, infect an awful lot of people, and then run out of new people to infect. Now, we're a much larger, much more diverse country. Perhaps our peak won't be that dramatic, but we would hope that Omicron will do its mischief and its damage over the next couple of weeks. And then perhaps toward the end of the month and the beginning of February, we can get our arms around this virus finally. If there's not another variant that crops up somewhere in the world and comes here. That's a big if, because I've been kind of cautiously optimistic twice, and first Delta and then Omicron crushed my optimism a bit.
And that's the big fear, right? The more people who get any virus, the more likely it is that it could mutate and you get a new virus. One piece of good news, surely, is the fact that the FDA has now authorized these Pfizer booster shots for children as young as 12. And not a moment too soon because, as you know, childhood hospitalizations keep hitting new records. They jumped 66% in 1 week. What is going on here? Is there something about Omicron that we're missing, or are these Delta cases that are putting kids in the hospital, or what?
Well, I'm sure it's both Omicron and Delta, but I think principally Omicron. It's seeking out unvaccinated persons or minimally vaccinated, and that means it's getting down into children also. Now, as you said before, the children are much less apt to get seriously ill, but that's not zero. And that means that Omicron will, on occasion, find a child with underlying illnesses or a perfectly normal child and make that child sick enough to be admitted to the hospital. And that's what we want to prevent. We need to vaccinate many more children. They're now all eligible age 5 and up. And then now that these children, these younger adolescents are eligible for the boosters, we need to start boosting them because we want to give them the best protection we can.
No question. You know, there's still so much confusion, Doctor, over the CDC's decision to modify the recommended isolation period for those who test positive for COVID. It was 10 days. It's now suddenly 5 days. First off, do you think that this new recommendation is backed up by the science?
The science is there, just as Dr. Walensky, the CDC director, has said, and it's been accumulating over time. Now, there's no doubt that everything we have seen regarding the disturbance in our society, the shortage of healthcare personnel, what's happening with the airlines because so many people have to be out because of COVID, even college and professional sports have been affected, and that brings it home to everyone. So the CDC is trying to walk a careful tightrope based on the science and reducing the risk to something that's manageable. So if you've been sick with COVID, if your symptoms are okay after 5 days, you can re-enter the world, but wear the mask for another 5 days. That seems to be a good balance.
But now there's this new wrinkle. Dr. Fauci is saying that the CDC is considering recommending a negative COVID test for patients before they leave their 5-day isolation. Why wasn't that part of the original recommendation? And what kind of tests are we talking about here? Are we talking about a PCR test, a rapid test? We know that rapid tests aren't as good at picking up Omicron as they have been with some previous variants.
And you're exactly telling the story as to why this was debated and continues to be debated. First of all, of course, what we know is that will require a lot more testing. And do we have the testing resources? You don't want to make a recommendation for testing and then not have enough testing resources. So that's an issue. The other is each of these tests has to be carefully analyzed and evaluated and used carefully. They each have their limitation. The rapid test, which is the one that's being used most often at the present time, sometimes can give you a false negative test. That is, you still have the virus, but the test comes back negative. But most of those people have only a very little virus, so they're probably not a danger to others. And if they wear their mask, that risk is reduced even further. So I can see the debate going on, and we'll see what comes out.
So then give us your prescription, doctor. When people are looking for tests, what kinds of tests should they buy? And when they're looking for masks, what kinds of masks should they buy? Because we know that a lot of schools and businesses are now tightening their requirements for what kinds of masks people need to be wearing.
Well, if you're going out to buy a test, the tests that most people get are the rapid tests that can be done at home. We've used them in my house to good effect to make Thanksgiving and Christmas even safer for everyone who's gathering. So that's pretty straightforward. Masks, let's all use them when we're in public places. And this does not count. The mask has to be above the nose, please.
Right.
Otherwise, it doesn't count. If you're using a cloth mask, make sure it has several layers. The surgical masks are fine. Those fancy N95 respirators that fit much more tightly, they're the best. They're harder to find, and they do make the work of breathing harder. So consider all those things when you use a mask. But please, use a mask correctly.
Exactly. A mask well worn is certainly better than no mask at all. Dr. William Schaffner, thank you so much for your advice today. We really appreciate it.
My pleasure.